What is going on, everybody? Welcome to another edition of You Guessed It, You Can't Make This BS Up. I am so happy to be with y'all tonight. Woo! I tell you, I hope everybody had a good 4th of July. I know I did. I got some needed time off and things of that nature. Also wanted you guys to be aware that I am totally excited about this podcast because we're growing. We really are growing. I'm seeing a lot of people that are coming from Germany that is supporting the podcast. Shout out to Germany, y'all. Got a surprise for you, Germany. Just give me a minute. I also want to give a shout out to the US of A. And I appreciate y'all so much. You know, we really been getting it in. We really been getting a lot of people showing support. I want you guys to know that there will be a Cash App now tagged at the end of the episode. So if y'all want to donate, that will go straight to the podcast. Also, too, if y'all hear any rumblings in the background, it is thundering where I'm at. So it's thundering with this storm. So please, if you hear the thundering, don't be alarmed. I'm gonna try my best to do everything I can to try to get that out of it. You know, I don't do a lot of editing on my stuff. I try to make it as raw as possible so y'all can get that real experience. Um, Man, what else I want to tell you guys about and everything? Oh yeah, I will be having a couple of people coming through on the show again in the next couple of weeks. I'm trying to work my schedule because right now me and my wife may be having some scheduling conflicts because she is trying to do some career changes. So we may be working side by side together in our everyday workforce life. I don't know how how or when is that going to happen, and if it does, you know, it may affect the recording a little bit. But we'll still try to focus on getting y'all good content out on Wednesdays. Also, to giving you the Black Friday of Black on Black crime, and I am about to release sometime this week a paid subscription episode. So y'all be getting that at least once a week as well. So without further ado, we about to talk about something that I really did not know anything about. Man, when I tell y'all I did not know anything about this particular individual that I am about to talk to y'all about, I didn't know anything about it for real. But this is a homage to Germany. That's right, Germany. I want to give y'all some homage. So this is about a I'm gonna tell you like this. What happens if you put your trust into someone that is supposed to be about making sure that you get the best care, not only just the best care, but also to ensure that your care is put first, and that them putting that care first, that you can trust them, that their intentions is all about your health. But what happens when the medical professionals that you're trusting to put your health first so you can be able to live and thrive a actual life, quality of life, is really got sinister intentions to possibly take your life? But this is what we're talking about when it comes to Niels Högel. Niels Högel. This is a man out of Germany. When you look at Niels Högel, you would think that Niels is like the type of guy that, you know, you wouldn't have to worry about him doing anything crazy to you. You would think of Niels Högel as a respectable man who looks like he is all about his job, all about his profession. But what if I tell you that this is the man, is the last face that you see before you officially close your eyes? Now, a lot of the stuff that I looked up about this guy is in German. So I had to get some translations and all that stuff done. But in reality, this guy was your everyday monster. That's what he was. He was your everyday average Joe monster. Because see, we was always taught that monsters are people that don't look like this guy, which I'm about to pull up in about a minute. We're taught that usually monsters are these guys that look shabby, that is disturbed, frightening. But no, not this gentleman here. This gentleman could pass as your neighbor. He could be one of your best buddies, bowling buddies, any of that nature. But he had a dark side. And that dark side was to ensure that when it's time to get busy with death, it's time to get busy with death. So without further ado, we are going to be getting into the story of, like I said, Niels Högel. Again, Niels Högel. Now, please believe I don't know all of these pronunciations in German. I'm not a German expert. So do not come at me on this podcast saying, Joel, you will butcher up our way of talking. No, it's just that I am an American and I only know what I know. Okay? I can do the best I can with what I know. So since I made that clear, I don't want to hear nobody else coming at me crazy. Let's go ahead on and jump into the story. In the small German town of Wilhelm Shaven, that's right, Wilhelm Shaven, on December 30th, 1976, a boy was born who was going to grow into one of the most prolific serial killers in modern medical history. And that young boy name is Niels Högel. Niels Högel was born to Paul Högel, who was a nurse by profession, and his wife, Margaret Högel, who was a homemaker. He had one sibling, and older sister named Christina. Now, Paul worked as a trained nurse in an intensive care unit, and young Niles often admired his father's dedication. Some neighbors would later describe Niles as shy, he was awkward, and he was desperate for validation. Growing up, he showed little interest in academics, but had an earlier fascination with the medical field, later influenced by his father's career. After completing high school, Hoggle enrolled in nursing school in Oldenburg and graduated in 1997. He started his professional career that same year. Okay, okay. Go get it right now. Niels Högel's first job was at Oldenburg Clinic. At first glance, he appeared to be a competent, not an overeager type of nurse. But colleagues began to notice an unsettling pattern. Patients seems to suffer life-threatening complications more often during his shift. And there was the thing about his shifts. They would see these patients have these life-altering complications, and all of a sudden, Niels would pop up like Superman and save the day. Yeah, 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 I got that. I got that. You know what I'm saying? Like, yo, fall back. This is what I do. I save people. You know, some people in his shift was like, okay, Neil seemed like he's really into saving people into his job. Others was like, yo, man, that motherfucker ain't right. A lot of people like, right now. And then every time they turn around when he working, there's all this cold blue, cold blue, cold blue, cold blue, all through the intercom. And people got to race to save a patient. And then when the patient almost about to pass away, he come out of nowhere, do some smooth stuff, and now the patient is back stable. And he looking around like, hey man, I'm the man. Where's my cigar at? Where's my hug at, baby? So people starting to say, yo, man, this is too much. So between 2000 and 2002, these whispers are starting to grow loud. Because patients under his care now went from being saved to now they dying at a suspicious rate. Yet, instead of launching a criminal investigation, the hospital transferred Högel quiet. Now, I'm going to tell you, since I've been working in the medical field a little bit, why hospitals like to do that. Hospitals do not like a lawsuit and they don't like attention, right? So if they feel like this person is a danger like this, they just like to push him off to someone else to deal with. Like, for instance, this hospital was right to say, well, we're a small hospital and we don't need this type of heat and bullshit. Let's push him over to the bigger hospital and maybe they'll find some kind of flaw or do something to fire him and we'll keep it moving and don't have to deal with this. But in reality, these guys don't never get caught up like that because they get comfortable because they know nobody's not watching them and people don't want that type of drama. So in 2002, he was reassigned to, and y'all please, I hope I did not butcher this word of the hospital, Delamenhorst Hospital. Now, it was here his crime started going through the roof because he had a perfect hunting ground and ain't nobody would watch it. See, Högel's method was terrifyingly precise and deadly. He would inject patients with unneeded doses of heart medication. Like, again, I hope I don't butcher the name of this medication, algemalene, lidocaine, and other substances causing sudden cardiac arrest. Once the patient began to crash, Högel would heroically, sorry y'all, my bad, heroically try to resuscitate them, sometimes successfully and sometimes not. It gave him a twisted sense of control and gratification. So, example given, cold blue. We got cold blue on room 106. Room 106. Hey man, step back. I got this. I got this. You don't you down me. Don't you down me. Here we go. Hey, there you go. Stat. Yeah. Give me some more of the oxygen. There you go. Who's the man? I'm the fucking. That's how his gratification was. And people's like, wait a minute, dude. Okay, yeah, you saved the patient, but why is it every shift you got all of these emergencies going on? Hey man, something wrong with old boy. I better check him out. He later admitted that he enjoyed the feeling of being the center of attention and the rush that came with trying to save lives he himself had endangered. Wow. Among the confirmed victims were, I hope I didn't mess this up, Gisela S. She was 62 years old and she was recovering from surgery. And she became a victim of this brutal man here. Heinz H. He was 87 with no heart problem. Horace K. 78, admitted for a routine infection. And dozens more. Many names were lost to time or misfiled records. The final official death toll, at least 85 confirmed murders, though authorities suspect the real number could exceed 200. Damn. The breakthrough came in 2005 when a coworker caught Högel red-handed injecting a patient with an unprescribed medication. The patient survived and hospital staff called the police. And let me give you an example of how that went down possible, right? looks like you're not near the brink of death yet. Let me go ahead on. Let me give you some of this medication here. Even though it's not been prescribed by the doctor, it'll help me get you back right. Hey, what are you doing, man? What you prescribing in that? That's saline. No, that ain't no damn saline, man. Hey, man. Hey, doc, man. Y'all need to check this cat out, man. This cat that gave this person the wrong stuff, man. Give me that needle. Oh my God. Hey, we need the right medication now. We need some other stuff to get things under control. You need to get out of this room now, man. Tell doc to put this man to the side. This dude don't need to be near nobody. And call the cops. And that's exactly what they did. And Högel was arrested. Initially charged with attempted murder, investigators soon realized that they were looking at something far more sinister. They ordered exhumations of former patients. They conducted toxicology reports and tests and reviewed hundreds of medical records. The findings were horrifying. Drug levels in multiple exhumed bodies were off the charts. Högel was first trial came in 2008, where he was convicted of attempted murder and sentenced to 7.5 years. But it didn't stop there. He had a second trial, 2015, led to a life sentence for 2 murders and 2 attempted murders. Still, investigators kept digging deeper into this man's past. In 2017, prosecutors reopened more than 100 cases. Niels Högel confessed to 43 more murders, and evidence tied him to dozens of others. Now, this is what some of the stuff he said on the trial why he did what he did. One statement was he wanted to impress colleagues. He admitted he was bored and addicted to the adrenaline of resuscitation. He cried in court but showed little genuine remorse. In June 2019, a German court sentenced Högel to life in prison for the 85 murders, the largest confirmed number of killings by a healthcare worker in modern history. And he's currently in prison at Oldenburg Correctional Facility. Now, y'all want to know what the hell happened to the healthcare system in Germany? Well, the German healthcare system was robbed. I mean, people was like, how y'all allow this to happen? And then don't forget, the families of the victims demanded answers. There was lawsuits being filed left and right. Hospital administrations faced investigations, but few were punished. The case exposed deadly flaws in the hospital oversight and accountability. To this day, many families have never gotten full closure, no confirmed cause of death, or no proper goodbyes. And you got one victim daughter told a German court, "My mother trusted that hospital with her life. Niels Högel took that life like it was nothing." See, and this is where I'm going to have to break this down, my final thought. Niels Högel was not by any means the archangel or angel of death. This man was a damn predator. He used his position not only to torture and abuse these elderly folks, but to also use it to play God. But it's all good because now justice has been served, and you're going to have to live in those small ass walls and think about everything you have done. Anyway, thank you for joining us on this particular case. That is the story of Niels Högel. I want everybody to know once again, like I said, do Cash App if you want to donate. The new Cash App is Cash App tag. You can't make this BS up, okay? Anything you need, just deposit to me. Hey, I'll be greatly appreciated. Let's see what else I got going on here in my mind. While I got my mind on it, we also got some housekeeping things about the podcast, guys. If you like the podcast, do me a favor and hit the star rating button and leave a comment. It really do help out the algorithm. If you ain't feeling it or you don't think I did good enough, then you got to go out on your way. And everything else. Let's see. We got some hosts coming up in a couple of weeks. If y'all got any kind of story or suggestion that you want me to do, please just go and email me at my email joshua.joel.davis 24 at iCloud.com. And so that's about it. Again, Cash App is on deck. Well, thank y'all for once again for everything that y'all have done. Y'all ladies are, yeah, I appreciate you. Take care. Y'all know what it is. I'm out.